Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Okay. Tumors of renal pelvis. So, in the tumors of renal pelvis, first we have carcinoma of renal pelvis. Carcinoma of renal pelvis includes first we have transitional cell carcinoma of renal pelvis. This transitional cell carcinoma of it is a this carcinoma renal pelvis is a transitional cell carcinoma of renal pelvis, and it accounts for about 90% of all upper urinary tract cancers are transitional cell carcinoma. Then, urothelial cancer is sometimes present as widespread urothelial abnormality. Here, the patient with carcinoma has increased risk of developing bladder carcinoma. So, for these patients with carcinoma renal pelvis, there is increased risk for bladder carcinoma of around risk for bladder carcinoma is around 30 to 50%, and there is also risk for contralateral upper urinary tract carcinoma. The risk for contralateral upper urinary tract carcinoma is around 2 to 4%. So among the patients with carcinoma of renal pelvis, 30 to 50% will develop bladder carcinoma, whereas 2 to 4% will develop contralateral upper urinary tract carcinoma. So this renal carcinoma is more commonly seen in male population.
thank you and thank you for watching.